Today we'll be looking at the fight against HIV and AIDS in Uganda. What are the challenges and the opportunities? Well, on the 1st of December, we will be commemorating the International World AIDS Day, and the main event is going to take place in Buyende district, so to be specific, Bukungu Primary School, and the theme will be as relating interventions to end AIDS by 2030. Well, it's a global target that by the year 2030, HIV and AIDS must be no more. So this calls for actions to be able to deal with the ever-increasing, infection rates. So what exactly are we doing as Uganda to move towards that target to end AIDS by 2030? What does our scorecard look like? Because there are already interventions that were supposed to be, implemented from the time this target was set, including what they call the 90-90-90 targets. Well, I have people here in studio whose work is dominated with fighting against HIV and AIDS to share with us, first of all, the status in our country, the interventions, and what the commemoration of the International World AIDS Day means. Let me introduce my guest, Dr. Daniel Byamukama. He's the head of HIV prevention at Uganda AIDS Commission. Good evening, Doctor. Thank you very much for joining us on this edition of Spectrum.
Good evening.
Also in studio, Miss Gloria Nawanyanga. She's the founder, Gilo Foundation, Gilo Young Positives Foundation, one of the organizations that is involved in the fight against HIV and AIDS. She's also a young person living positively with HIV and AIDS. Good evening, and thank you very much for joining us, Gloria.
Good evening, and thank you for hosting me.
Right. Dr. Daniel, we will be commemorating the International World AIDS Day on the 1st, but it will be very important for us to understand where we are as a country. There's been a lot of concern. At one point, we were, envied as champions across the world because of the efforts that had been put in, not only at community level, but even at a political front to be able to deal with this problem. Then there came a situation where the infections kept going up, and sadly, among young people and even married couples. Where are we as a country when we look at the fight against HIV and AIDS? What are our statistics as we prepare to commemorate this day?
Thank you. I want to start from the last point, that HIV is highest among married couples. Yes, there is HIV among married people, but they don't have the highest. I will tell you the highest. The highest are adolescent girls and young women. Girls between the age of 15 up to 29. They take position number 1 in the country on the number of new HIV infections. The second, they are men, but not married men, but men who were formerly married. So those who have failed in their marriage, or they have separated, they take position number 2 in the number of new HIV infection. And when we trace the data, we see that they meet their needs casually. They engage in so much casual sex. Like 95% of all men who were formerly married engage in casual alternative of meeting their needs, and they don't even remember to use protection. Number 3, it is formerly married women, divorced, separated. They also engage so much in casual alternative of meeting their sexual needs, and they don't use protection. And number 4, it is the sex workers, the ones they call nekolera jange. So you can see the married people come in a distant 5th, and then the unmarried, the other young people. So it is not true that married people are leading, but that said, our fight against HIV AIDS is still on. We are making progress in some parameters. We are making not good progress in some parameters. We have a few years, 6 years, to the landmark of 260. I must convince the listeners that the goal of ending AIDS as a public health threat by 2030 is not a Uganda goal only. It's a global goal. Every country is targeting that goal. And as you rightly say, from the beginning we had been the go-to country to run best practices, to run what to do. And unfortunately, it looks like some countries came and learned and they are overtaking.
Mm.
So the leadership position is some other countries are outcompeting us. So when I give you an example, you talked about the presidential 95-95. So the 90-90-90 targets, when the president launched the presidential fast track initiative, the first targets were for 2020. By the year 2020, we should have tested at least 90% of all people living with HIV and let them know their HIV status. Of those tested, at least 90% should have been started on treatment. And of those on treatment, at least 90% should have attained what we call viral suppression. Now, the viral suppression is the final reward. When people attain viral suppression, it is good for their health. They are not going to get sickly, but they are less likely going to transmit HIV to others. But now, after 2020, the Presidential Fast Track Initiative set new targets to 95, 95, 95. And these targets are actually aligned to global targets. 95, 95, 95 by 2025. Now, I said the goal of ending AIDS as a public health threat, every country is in it. Some countries have already attained the 95, 95, 95 targets of 2025. And as Uganda, we have not yet. So several countries, like 8 countries, have beaten us ahead of time on the goal of 95, 95, 90 targets. These countries learned their response from us. So that calls on us as individual countrymen and women, as leaders of various categories, as health workers, to accelerate, to not get complacent. There is some little complacency that has stayed around. We celebrated our limelight, the praise we had as our leadership, the achievements we had in the area and the response. And so many people are basking in that achievement, but so many other countries have overtaken us, and we are not making good progress. We are not making good progress. I can give you an example. AIDS-related death, the people who are dying of AIDS-related illnesses in the country, the number has not changed since 2021. We are around 20,000 deaths. Ideally, between me and you, there is no person who should be dying of AIDS-related illness in this country. We have medication, so accessible, free, easy to take, but 20,000 died. There are very few diseases that contribute to 20,000 deaths every year. They are very, very few. If at all they are there, one single disease. So AIDS-related deaths, 20,000, they have stayed around there, which means that we became comfortable. We became complacent. We have not engaged at the rate at which the countries that started their responses later are engaging. I can give you another example. We got new HIV infections. There are still so many new HIV infections. If we are to end AIDS as a public health threat by 2030, we have set targets to show that actually we are on progress. We had 38,000 new HIV infections last year. 38,000 new HIV infections is not good enough. It is still very high. It is far behind our target. You see, our target when we launched the Presidential Fast Track Initiative, our target is that we should have reduced the number of new HIV infections to at least 20,000 by 2020. You can see this is 2024. We are at 38,000, which means we wanted to reduce to at least 15,000 by 2025. You can see we are not on track to attain our goal of 2025. And we are concerned that if we don't wake up as a country and we really do the work that needs to be done, we may default on our commitment to end AIDS. But I want to assure you that some of the countries in our neighborhood look destined to attain those targets, to end AIDS in their countries. Countries like Rwanda, countries like Zimbabwe, countries like Botswana, even Kenya, even Tanzania. They look destined to actually deliver the end of the epidemic. So I want to call on our leaders, on individuals, on health workers. We have basked so much in the achievement of long ago. We have become so complacent and comfortable. The work that needs to be done is still enormous for us to attain the targets. and the people who run from us are outsmarting us. We need to wake up and get back on the treadmill and work hard.
All right, I'll be coming back to you to understand what those countries are doing that we can now go back to them and learn what they're actually doing, so that we can also catch up with them. But let's hear from Gloria. Gloria, you are a young person living with HIV and AIDS, but also involved in the fight. The statistics that have been shared by the doctor here indicated that actually HIV and AIDS is among adolescents, especially young girls. As you do the work of fighting against HIV and AIDS, have you been able to, understand why we have this kind of situation, and what kind of messages do we need to give these young people to be aware of the danger that is lurking?
Okay, thank you so much, Mr. Presenter. First of all, allow me to talk about what I've been doing and what I'm doing. And through Gilo Young Positives Foundation, which is my organization, we are empowering, educating and equipping young people and children to improve their livelihoods and well-being. But also we do a lot of advocacy around HIV prevention, care, support and treatment. And Dr. Dan has clearly said that when you look at the statistics, so many adolescent girls and young women are getting infected with HIV, and it's so shocking that when you still look at the statistics and prevalences, you see that approximately 570 girls get infected with HIV every week. Every week, approximately. And these are huge numbers. As someone who has grown up with HIV, as someone who knows the challenges of being with HIV, growing with HIV, taking medication every day, it is so difficult for me because I wouldn't wish what I'm going through for another person to go through it. That is why I share my story, and that is why I do the advocacy and tell young people out there, hey, look, if you're HIV negative, please keep it safe. If you're HIV positive, nevertheless, it's not the end of life. You can still study. I'm a lawyer by profession. You can still, achieve your dreams, get married, give birth to children who are even negative. But I don't encourage young people to get HIV. And during my so many activities that I've been doing in my communities, I've realized that most young people are taking their lives for granted. And that is why we have so many campuses who talk about getting HIV rather than getting pregnant. And to them, they think it is okay or it's easier to have HIV. And I can assure you that it's not easy to live with HIV. It is not easy to take the medication every day. And I always tell people out there, especially in our communities, that most of you, they give you Coatam, and you have never finished the dose. Imagine taking medication every day. And trust me, of late, I'm having challenges taking my medication. I feel the tablet is becoming bigger and bigger every year. You understand? So it's not easy to take medication every day. Secondly, it's not easy to accept the fact that, okay, I'm HIV positive, but life has to move on. That is addressing the self-stigma. We have two types of stigma, the self-stigma and the external stigma. First of all, for me, I tell people, it all starts with you. If you deal with a self-stigma, that means the world got nothing on you. The world cannot put you down because you have dealt with your inner person, your inner fears, your inner stigma. So it's not easy to deal with a self-stigma. It took me over 10 full years to know that, okay, I have HIV, but life has to move on. Life has to go on. And killing myself, because I tried to kill myself several times, is not the answer. It's not the best solution. So young people are taking HIV for granted. Secondly, we have a lot of stigma and discrimination that is associated to HIV. And it's very, I don't know, how can I call it, a shaming, or I don't know, because when you go to communities, people say that, people are living normally with HIV. There is no stigma. Let me tell you, I'm a person living with HIV. Personally, I've ever faced stigma and discrimination, and I am still facing stigma and discrimination. If you can go on because for me, I'm living a public life. If you can go on my social media, even today, my recent post on TikTok, people have been abusing me. How I am a prostitute, how I am a dead walking body, how I should not even talk about my HIV status, how I should be in the closet, and people keep on saying shamelessly that stigma is not there. Stigma is there and it's killing people. And this has also led to people non-disclosing. Of course, when someone does not disclose, they will keep on infecting others. And why do they fear to disclose? It's because of the stigma that's associated to HIV. People will be like, someone will be like, why would I disclose if I know that they're going to dump me? They fear to be dumped, they fear to be neglected, they fear to be stigmatized, and all that is because of stigma and discrimination. But I also feel like there is a gap when it comes to educating young people, especially those school-going children. We have a problem, I think, in the way we are packaging our information when we are sensitizing people about HIV. I understand there were big drums back then in the maybe late 90s, early 90s, if I'm not mistaken, that was saying HIV kills. But now, I don't know if the communication has somehow been, been misleading, that it has, people have started taking it for granted. So we need to go back to those strategies that we used, probably just like Dr. Dan said, those early times of those intervention in fighting HIV, and tell people that HIV is still there and HIV is still killing people. Dr. Dan is from saying that we got over 330,000 deaths, right? These are huge now. 38,000 deaths. People are dying of HIV, and people don't actually know that people are dying of HIV. You understand? When they see us looking beautiful, when they see us doing amazing things, they're like, "Oh, Gloria is there."
And I was going to tell you, how do you make this message to actually sink in when you stand before young people, looking healthy the way you are, beautiful the way you are, to actually tell them that, look, HIV and AIDS is a killer. Doesn't that feed into what you actually said? Many campuses will say, I would rather have HIV and AIDS than get pregnant.
Mr. Kenneth, we're having a problem that some people are actually misinterpreting our message. When I come out and talk about my HIV status and share my story and tell you, hey, you can still study, you can still live your normal life, even when you're living with HIV. I'm not telling you go and have HIV. And that is the case we are having with Pastor Semper. I don't know if you know Pastor Semper.
Pastor Martin Semper.
Who was saying that I'm an HIV model, beautifying HIV, encouraging people to go out there and get HIV. And he was telling people that they should stigmatize us, people living with HIV, so that people fear HIV. You understand? But that's not our purpose. That's not our aim. Our aim, however much we are trying to instill hope in those who are already living with HIV, we're also telling people that, hey, it's not easy, just like what I said earlier, to live with HIV.
All right.
I'm looking good, but you don't know what I'm going through. I'm looking good, I've studied, but you don't know my battles. You don't know the depressions I've gone through taking my medication. You don't know what it means to think that I'm going to be taking this medication for the rest of your life. So it's not easy. My message to young people, please take the interventions. Test, first of all, it starts with testing, knowing your HIV status, and if you're HIV negative, protect yourself, use condoms. We have so many prevention methods right now. We have the injectable PrEP, we have the oral PrEP, we have the event-driven appeal for boys that they take within 24 hours. We have, there's so many HIV prevention options that they can take to protect themselves.
All right. Dr. Daniel, Gloria here raises a very, very interesting scenario when it comes to young people. Young people not fearing to get HIV and AIDS. They would rather get HIV than get pregnant. And yet, this is the future. If the message is not sinking in, are we not going to lose the battle? Will we actually be able to get this kind of targets? How do we effectively deal with this issue, especially among the young people who are from among which infections are increasing? Gloria says it's estimated that every week we actually get 570 new infections from among young people.
Thank you. It's a concern of the national HIV response that young people, they have not seen and they are taking for granted. They have not seen the real AIDS, how it looks like, the pain it inflicts on people. And for us who saw a person who has AIDS, how they look like, we have some respect for the disease, for HIV and AIDS. But the young people, they have not seen. But we have a duty. Number one, we have a duty as parents to inform our children about HIV. Unfortunately, not so many parents are doing their duty. They are busy looking for money, or they don't have the information. All the time we're doing demographic health surveys in the community to find out the level of information. Not so many people have complete, accurate information. But even those who have accurate information, they don't have the skill of broaching the topics of HIV, sexuality. So there are so many challenges. But as the government, we are making an effort to bridge the gap. The gap for those kids who don't have parents who stay with them, for those kids who are orphans, for those kids whose parents are not educated or are not informed about HIV or don't have the skill. We are introducing what we call education. We are introducing it in the curriculum. The good thing is that at least at one time, almost most of the kids in Uganda are in school. So we see that introducing HIV education in school, in the school curriculum, will help us bridge the gap of parents not having the will or the skill or the ability to talk to their children. And beyond school, we're also starting up initiatives to talk to those who are out of school. Several out-of-school children need this information. Several out-of-school children are really emboldened by seeing so many HIV-positive people moving around beautiful, and they don't know. We are counting on communities. That's why I thank Gloria. She shares her story. If you see her and you see her, she has contested in Miss Uganda beauty contest. So if you see her and you see the beauty, but she gets down to tell you her story, if you really have ears, you must listen and never take it for granted that having HIV is a simple journey. So we are doing whatever is required to get to the young people, but we cannot do it alone as health workers. It requires everybody. When we started the HIV response, the HIV prevalence was as high as 18%. That was in the early 1990s. But by 2003, when we started giving out antiretroviral drugs, we had reduced it to around 6.5%. And that was mainly by talking. Who was doing the talking? And we were young at that time. So who was impacting us with the information that helped us, keep us away from contracting HIV? We were teenagers at that time. It was religious leaders. It was political leaders at every function in the community. Be it a funeral, be it fundraising, the political leader talked about HIV. The religious leader talked about HIV. And if we are to win the battle, because there is a whole generation of young people who miss that opportunity of education by their leaders. They are now the sexually active. They're the ones getting married. We would want to ask our leaders to get back to the campaign of mobilizing communities. If the communities are not mobilized, and that mobilization can only be done by leaders, to mobilize them to get to know that we have a goal of ending AIDS by 2030, it can be done, and informing them about the tools we have. What tools are there? The last time in the 90s, we had only ABC. And with ABC, we managed to reduce the prevalence from 18% to 6.5%. But now, on top of the ABC, we have so many other tools, including tools of those who cannot afford to abstain, including tools for those who cannot afford to be faithful to one partner, including tools for those who cannot even afford to use a condom. We have options for everybody, and we really believe the goal of ending new HIV infections is achievable. The good news is that some countries in our neighborhood are already demonstrating that it can be done. So we would want to challenge our leaders, religious leaders, political leaders, cultural leaders, come out like you did, or your elders came out in the 1990s and mobilize our communities. We should not default on our commitment to end AIDS as a public health threat by 2030 because the leaders are complacent.
All right. Yes. Spectrum on Radio 1 FM 90. We need to go for a break now. When we return, we've heard about the issues to do with the young people, but the statistics shared by Dr. Daniel also indicate that men could are among those with the highest infections, and could there be a link between these men and the young people that we are looking at? Because the statistics for young people indicates that new infections every week, 570, but where are these infections coming from? What is driving these infections? But also, at the end of the day, we need to see how we can scale up the interventions to be able to address HIV and AIDS in our country. Stay tuned, Radio 1 FM 90. Keep your comments coming via the WhatsApp line, which is 0703 090 090. Spectrum continues after this. Well, we are glad that you're still with us on Spectrum, live on Radio 1 FM 90. Our topic of discussion today is the fight against HIV and AIDS in our country, Uganda, challenges and opportunities going forward. This is in line with the fact that on the 1st of December next month, we'll be commemorating the International World, we'll be commemorating the World AIDS Day under the theme Accelerating Interventions to End AIDS by 2030. 2030 is a global target. We must have, all countries in the world must reduce HIV and AIDS, or even end it by 2030. Uganda has been focusing on that journey, and you might have heard from Dr. Daniel Byamukama in our earlier segment telling you or giving us statistics where we are. Unfortunately, we are not doing very well, so there's need for us to actually double our our efforts. My guest, Dr. Daniel Byamukama, he is the one in charge of ending HIV and AIDS at the Uganda AIDS Commission. But also in studio we have another guest who is Gloria Nawanyanga. She is the founder of Gilo Young Positives Foundation. She's also a young person living with HIV and AIDS. Now, Gloria, let me get back to you. You heard the efforts that Dr. Daniel has talked about, the things that need actually to be done to be able to address the infections. Other countries are making progress, but we are not. Let's hear from you as a young person. When you sit down and look at our our strategy to intervene, our response, HIV and AIDS response, what do you think we are doing well, and what do you think we need to improve as a country?
Okay, thank you so much for that question, and I want to thank the government of Uganda for, first of all, the tremendous work it has done under His Excellency, the President of Uganda. And of course, I cannot say that the government has not done something. For sure, the government has tried to do something, though of course we still see that a lot has to be done, but we have so far so good interventions that have really helped us to see that we end AIDS by 2030. And let me start with the intervention of the test and treat, which is a very good policy. Back then when I started medication, that was in 2009 when I started the ARVs, we used to take Septrin before going on ARVs, and Septrin was to boost our immunity system, the white blood cells. So till your viral load goes high, that is when they would give you the ARVs. But now, when someone is tested positive, immediately they get the medication. And to me, that is a plus. We have the medication, we have the ARVs, and of course we also have so many HIV prevention interventions, which is also a plus to the government of Uganda and different development partners. We have the condoms readily available everywhere in all government hospitals, though still young people are failing to use them, which is a problem. We have interventions like PrEP and PAPE, that is the pre-prophylaxis, pre-exposure prophylaxis, and the post-exposure prophylaxis, which helps someone to, prevent themselves from getting HIV. We have the vaginal ring, we have the injectable PrEP, and all these interventions are in Uganda to help in, in ending AIDS by 2030. But I also believe when it comes to the gaps, just like I said earlier, we still have a gap in the way we disseminate our information, especially among young people. Just like Dr. Dan said, back then, the religious leaders, the different leaders in their different capacities used to spread this information and people would listen. But why are young people nowadays, the Gen Zs, failing to listen to this information? That means there is a gap in the way they disseminate this information. Secondly, meaningful engagement and involvement of young people. We have all these good interventions, but has government really engaged and consulted from young people? And maybe the reason why young people are not using these interventions is because they are not consulted. You are going to go come up with these interventions, but young people have not given their views. Young people have not, contributed to say that, okay, this will work for us, this will not work for us. At the end of the day, young people neglect such interventions. So we need young people to be put at the front line when it comes to decision making and policy making, but then also having these interventions and also making sure that young people contribute to the implementation of these interventions. Lastly, we have a problem in our laws and policies. Recently, we have been struggling with people who have been dismissed because of their HIV status.
Really?
Yes, because of their HIV. And we have them just because people fail to come up to talk about these instances. But
dismissed from work?
Yes. I have people in my inbox who come to me and they tell me, Gloria, my boss fired me because he phoned me that I'm HIV positive. I even had someone from, I think, Kamuli or Iganga, who was telling me, Banango, we tested our maid and she was positive. We are thinking of firing her. What should we do? Imagine. And does it mean that if I'm a maid and I'm HIV positive, I'm going to infect you? So people still have, I don't know, is it related to stigma? Is it the myth and misconception? Because now if someone is fearing to use a maid who is HIV positive, these are people who think that
maybe it's because of
food.
Maybe it's because of what we've been seeing, what maids have been doing to children.
I don't know about that. I don't know.
You've seen videos where maids have been beating children. Others.
But that is not related to HIV. I'm talking about things that are related to HIV. These are the people who think that when a maid prepares food and they're HIV positive, they get infected with HIV. So we have this HIV work policy, which are there in existence by the government, but they are not implemented, especially in the private sector. We have the HIV Control and Prevention Act, but it's not actually implemented, and it protects people living with HIV. But then also there are still some gaps in these, policies and laws that are, related to HIV. So we need these laws to be, first of all, implemented for those that are protecting people living with HIV, but then also for those that discriminatory in any nature. We had the legal environment meeting, and excuse me, and people were saying that there are some sections in the HIV Prevention and Control Act that are a bit discriminatory and a bit that violate human rights. For example, mandatory testing. I mean, it should be a choice for someone to test for HIV. It should not be a must or mandatory because I have a choice. You understand? Though it's also very important for that person, to test for HIV, but you should not coerce me. You should not force me into it. So we have still those loopholes, and I believe that if the government works on that, we'll be able to achieve our goal of ending AIDS by 2030.
Dr. Daniel, the theme this year is accelerating interventions to end AIDS by 2030. I know Uganda AIDS Commission has a strategy as what do they call it, action plan to be actually to roll out to deal with to roll out the interventions that are required in line with its particular target. But one of the things that I've heard while interacting with the people in the health sector, including some people from Uganda AIDS Commission, the issue of the funding. Are you armed to actually deliver on these targets that we are looking at? Are you able to accelerate?
Now, that is a loaded question. The truth is, I don't want to blame funding at this time. It is like the story of the condom. The people are always finding an excuse not to use a condom. So they are waiting for you to say the condom is not 100% efficient so that they can go without a condom. So I don't want to feed that narrative to say we have a challenge of funding. We have enough antiretroviral drugs in the hospital. But we see people, we start on treatment and we wait for them after 6 months. Some of them not come back. Others have been tested. We have tested. We know that around 92% of people in this country know the HIV status, but not all of them. It's only 90% of the 92 who actually come for antiretroviral drugs. Another another 8% of those who already know the HIV status, they are languishing somewhere. They are not coming. We have not said we are short of ARVs to give them. No, we are not short of test kits. But that said, so a major part of our failure to deliver according to our targets right now is not majorly because we don't have money. No, it's majorly because of our attitudes as individuals, especially men, our poor healthy behavior. Talk about children. Mothers are HIV positive. They have delivered children who may have been exposed to HIV infection, but they don't bring them back. They are leaving them to suffer with sickness. If they brought them back, we'll give them preventive methods or would start them on treatment early in case they're HIV positive so that they live normal lives. But mothers are not bringing these children back. And as a consequence, a significant number of children are dying from AIDS-related illness. So are teenagers. So partly, our problem is due to finances. And now I can give you an example. We want to implement, there are certain evidence-based interventions that help especially young people, especially young women, reduce their risk and vulnerability to HIV. In the country, we have 140 local government districts and cities or so, like 146. And we have earmarked that 65% of these cities and districts need a certain special comprehensive package. The girls in those districts need to be reached at a personal and comprehensive level. But I want to tell you that we have money to reach only 44 of these local governments out of the 65. So that means the other 40, the other 11, there is so much. The fire is raging, but we don't have enough money to go there. So the answer is yes and no. We have money for certain interventions. Interventions like condoms. We have enough condoms for everybody who is engaging in any risk activity to be protected by a condom. But how many people are remembering to ask for this condom and use it? We have tried so many innovative ways to bring the condom closer to the people. But at the end of the day, how many young men or young women who engage in risky sexual behavior remember to get this free condom that is brought and put for you in a bathroom somewhere, is brought and put for you at a health facility, or is brought and put in a condom dispenser at a certain trading center or at a certain tree. So there is a challenge in attitudes of individuals. So what I see in the end right now, if I were to ask right now, given a choice to ask for one thing that will contribute to the end of new HIV infections, I would not ask for more money from government. I would ask individuals to change their attitudes, to take up the prevention services that are already there, to change their attitudes. Does A require any money to abstain if you're a young person? Does being faithful require additional money? No. I have already told you have enough condoms to prevent every risky sexual contact in this country. But how many are using them? It's only a small proportion. I can give you the statistic. We see from our surveys that a significant number of married people are engaging in extramarital affairs. That does not include your husband, the person who is listening. But a significant number, close more than 30%. But only 10% of those who engage in extramarital affairs remember to use a condom. So you can see the problem, how it is. We are not short of condoms. They are there in this country. So if you see most of the effective strategies we have, A, for abstinence, B, for being faithful, C, for condom, we have enough. They don't need additional money. Let's go to the other key strategy, which is antiretroviral treatment. For the people living with HIV, we have discovered through science that our brothers and sisters who are living with HIV, if supported well, and they start on HIV treatment, and they take it as the doctor has prescribed, they attain a state we call viral suppression or undetectable. We cannot detect the virus in their blood when we draw with a syringe. At that state we call undetectable, which is attained by people who have been taking their medication well for some time. Those people do not transmit HIV. We are not short of drugs.
Okay.
Look here. Number two, what is actually stopping some of our people from taking the medication as prescribed by the doctor is the unsupportive environment we have created. We are shaming our brothers and sisters. You go to families where there's somebody who has HIV. They're the ones who are harassing them. You harass your brother because you think you're better than him because he has HIV. That interferes with his ability to adhere to treatment. That does not require additional money. Yes, we need more money, but if the people were to do the basic things we are asking for, if we were to cooperate and everybody, the HIV negative, the HIV negative positive, did the basic things that need to be done immediately, we would end the epidemic without additional money.
All right. Let's get feedback coming in from the listeners. We have messages that have been sent in via the WhatsApp line 0703-090-090. So I'll read them out and you respond to some of them. We have a comment coming in. Hello, Gloria. Thank you for the courage. Personally, Philip Bongole Lutaya kept me alive. I saw him. He encouraged me and made me fear HIV. For my daughters and sons, they haven't seen HIV. That's our challenge as parents today. That's a comment from Musa, listening in from Chireka. We have a comment coming in from Mawa Jacob Amaza, who writes in and says, good evening, Spectrum. It's mostly the adults who are infecting the young population. The massive poverty levels is another big factor contributing to the spread of HIV in Uganda today. Maybe the availability of ARVs is also making them fearless. That's a comment from Mawa Jacob Amaza. Another comment comes in. Good evening, Radio 1. I'm listening to the program. It so happened that I was born in the 80s, and what I really saw during that time when AIDS was at its peak, schools, radios, worship places, and all open places which could gather big numbers were all preaching one word: AIDS is real. The only way to keep safe is abstinence, being faithful to one sexual partner. But now I can hardly hear any radio advert sensitizing people about HIV and AIDS, nor even in worship places. I think we have lost it that way, and that's why AIDS is on the rise again. That's a comment from Robert, who is listening in from Entebbe. Then we have another comment, Vincent from PG. May you first ask the doctor for me if the injection method for HIV is now in Uganda. Thanks for the program. Then another comment, tell your guests that unless poverty makes women, girls vulnerable, illiteracy rates in the population who even said that HIV has not come to kill trees, the 38,000 may not reduce as anticipated. Then we have another comment. Good evening, Spectrum. Thanks for the show. AIDS scourge is on the rise simply because most parents, religious leaders, singers, among others, have been so complacent. For instance, it's not uncommon to go to many places of worship, and I bet you won't hear any message in regards to scourge. On the contrary, they preach politics, who you should vote, or talking about which politicians contributes how much to them. The ARVs, drugs, have also contributed to this increase, simply because people living with HIV and AIDS who care about themselves look very healthy, and even when the affected person cautions those making passes on to them, they still insist that they are healthy and they want to have a relationship with them. Let the government continue awareness like it had started earlier on. That's a comment from Kamugo Fred Keta, listening in from Kira Municipality. Now let's respond to some of these comments, and I'll begin with you, Gloria. There's a parent who actually says many young people do not know the face of HIV and AIDS, like he saw it during the Phile Bongole Lutaya time. What advice would you give this kind of parent?
Well, before I even give the advice, I want to talk about what Mawaza said, I think from Chireka.
Mawa?
It is very true. Yes, it is very true that we have
massive poverty.
Yes,
that's
we have high rates of poverty, high rates of unemployment, and lack of economic empowerment. And actually, that is one of the reasons why most young people, especially adolescent girls and young women, are getting infected with HIV. One, they engage themselves in transactional sex so that they can survive, because first of all, they are poor. They don't have money to survive. They don't have what to eat. They don't have basic needs. Imagine, I am HIV positive. I'm a young girl. I am taking my medication. I don't have a job. I'm not educated, but I need to take my medication. Can I take my medication on an empty stomach? Do you think it's visible to take medication? It's possible to take medication on empty stomach? No. So it will prompt that person to go probably maybe seek for means to survive, and some of those means are not good means, like transactional sex, like sex work, which put them at risk of getting HIV, but then them also infecting HIV. So it's very true that we have high rates of poverty and unemployment and lack of quality education or access to quality education. And if the government can only help us and make sure that at least young people, especially those living with HIV, have education scholarships. Personally, I lost my father when I was in my first year at university, and he was the breadwinner, and it prompted me to stop school for some time so that I can work and raise money to go back to school. So imagine someone who is deep down in the village, who lost someone who lost their parent, and they are living with HIV, and probably they cannot even access primary education. What do you think they will resort to? They will resort to those risky behaviors. So education is really important. I call upon the government to look into it. Education scholarships is what we need as young people living with HIV. Secondly, employment opportunities, economic empowerment. Poverty is contributing to the high rates of new HIV infections among adolescent girls and young women. Going back to your question, personally, I did not see Phil retire, during that era, but Phil is also my great inspiration, and recently at the National Symposium we were celebrating him. However, I saw my father die of AIDS, and I can tell you, one of the things that prompted me and pushed me to go and make this noise about HIV, I wouldn't wish to see anyone die the way my father died. Dying of AIDS is something scary. I don't even want to talk about, become emotional. But dying of AIDS, it's something very difficult, and I wouldn't wish anyone to go through it.
All right.
So please protect yourselves, young people. Protect yourselves.
All right, let's hear from Dr. Daniel as we come to the end of this show. If he can quickly give us his closing remarks, but also respond to some of the few key issues that Gloria has not touched.
I think most of the comments from the listeners, they were really...
Comments are not questions.
Comments, intelligent comments from active community participants, and I welcome several of them. I want to come down to poverty. You see, poverty, we agree it contributes to the epidemic. But if poverty truly contributed to the epidemic in itself, there would be anarchy. There would be, a big problem. There are so many poor girls across the country. If indeed poverty was the real cause of why people engage in risky behavior, there would be a problem all over the country. A country like Burundi, the HIV prevalence is half the prevalence in Uganda, but the poverty in Burundi is much more than the poverty in Uganda. How come they have less the percentage? I am not dismissing poverty, but I'm saying on top of poverty, there is something else that is exacerbated by poverty. So it is something else that we have created, a culture, maybe a culture of complacency, a culture where parents do not guide their children, they don't have relationships with children and guide them. So children learn from wherever, from whatever experiments, a culture of greed, and wanting what you cannot afford yet. We have created it here, and we really think the people who can save us is the religious leaders.
All right.
We listen to religious leaders. But secondly, for young people, we have discovered that keeping young people in school is so protective.
All right.
We would want to encourage everybody to endeavor to keep their child in school, especially the girl child.
All right. I'm afraid time is not our best ally. We have to bring this discussion to an end. Please, thank you so much, dear guests, for making time to actually be here to share with Uganda. This is a discussion that will continue going forward as we prepare for this World Day Against HIV and AIDS. Tomorrow, we'll be doing another edition of Spectrum Extra. Join me then. Review of the major events of the week. But up next, we have the news in English with Miss Josephine Dagano. Thereafter, we'll have the Soul Train with BP Junior.